Hi, I'm Lisa Maki, and I'm the co-founder and CEO of PocketDoc, a health marketplace where we connect consumers directly to providers to shop for treatments and services with transparency. And related to that, I've been noodling on something. I've been thinking about a pretty hard problem for me, and I thought this would be the perfect audience to test it out on. So what is it? It's a done deal. The cost of care is shifting, has shifted to the consumer. We tend to talk about that shift, characterize that shift as a cost containment problem, something we need to address, something we need to reduce. But lately, I've been wondering if it might not be beneficial to think about it just a little bit differently. Turn it around, turn it on its head. Because no other industry looks at over $300 billion in addressable consumer spend as a cost problem. They look at it as a revenue opportunity. What if we did that in health? Think of what we would have to change. If instead of focusing on reducing the cost, we focused on maximizing the most amazing consumer shopping and purchasing experience ever. Now, I'm not talking about acute care. That is what my high deductible plan is now for. But for primary care, maintenance, semi-elective, elective care, absolutely. Think of what we would have to change about current design and delivery and marketing to deliver on that. Now, I know this is not how we think about it today. We're thinking about how to carve things down into capitation, not blowing it out into consumer segmentation. Why would I want to spend more on one provider over another for the same treatment? Same reason I do in any other industry. To get more service, to get more convenience, to get something more of what I want. In that kind of competitive marketplace, one size does not fit all. Now, when healthcare was free in the US, I think we were content to be treated as a unit of one. But now that I'm paying for it, I'm not. I want to feel like an opportunity. I want you to market to me. I want you to convince me I should spend my money on you. And if you think this sounds crazy, these guys who are very familiar with our consumer buying behavior are already doing it. They've segmented me. They're marketing to me. They're getting me to walk in their door and spend my dollars there. They market to me where I work, where I live, where I shop. And they're getting me to buy a gallon of milk while I'm doing it. They are not afraid to market to my basic human foibles, my fears, my dreams, my vanities, because they figure if they're transparent about it and I make a conscious choice and they deliver, that's a good transaction. They're building a relationship with me. They're telling me who they are, what they're selling, how much it costs. And that's a huge differentiator in this market where it's rarely done. So this group, this amazing group of scientists, all this beautiful science, all this amazing data, I'm asking you, is the problem really that we're spending too much in healthcare, or is it we just don't know what we're spending it on? Who am I paying? What am I paying for? Why is it the cost that it is? Because there's people that have you believe in the U.S. we don't, as consumers, really want choice in health. But I would argue I'm a health consumer, and I do. I experience that as respect. I experience it as power to put my dollars against things I want, for things I want. So we've done an amazing job of using the data to figure out what to do at just the right time, to tell people how to be healthy, to manage those complex systems. We're getting better than ever before. I'd like to see, in addition, not instead of, in addition, could we borrow a page from these guys and use that data to learn how to market it to people, make them want it, build stories and experiences around that healthcare that they care about. Now, I'm not trying to tell you that all of a sudden people are going to do everything they're supposed to do. Those guys also know that temptation and irrationality are part of the human condition, and they market to that too. I'm not out of my mind. However, I'm increasingly optimistic that if we are willing to borrow a page from their book, use those tactics, use all this amazing science and data, we'll achieve some of the things we want to achieve. We will have to lower cost and waste in order to preserve the profit margin. We will have to improve service to get customers. And in that market, if I'm spending more on my health, that's not a cost problem. That's a great thing. That means you've succeeded in making my health my priority. Thank you very much.